Okay, hi everyone. My name is Dr. Kinsey, and I am a pediatric pelvic floor physical therapist at Reborn Public Health and Wellness. I am located in our Lehigh location, and then we also have providers who see pediatric patients in both of our other locations in Murray and in Layton. But today I'm just going to kind of go over what is pelvic floor physical therapy, how it impacts your kids' health and well-being, and why it's important, and when would be an appropriate time for you to come see a professional, and just things like that. So we're going to touch on all of those things today. So first of all, what is the pelvic floor? Pelvic floor is not just the muscles, but it also includes ligaments and connective tissue, and then all of those things together support the bladder and the rectum so that they can function properly. So there is muscular control involved, there is ligamentous support involved, and then there is also just support up and down the chain. So what is going on in your spine and your pelvis and your hips all combine to support your pelvic floor. And then there's muscle control involved in just those sphincter controls, pelvic floor opening and closing to pass urine and stool. But overall, we just really want to make sure that pelvic floor health is really important, just because a lot of these things are things that we don't really talk about and can be really embarrassing for kiddos. And so not only is it important just for that aspect and control of movement, but then also just for mental health and well-being of you and your kiddo. So what are some common pelvic floor issues in children? So bedwetting after being potty trained. So again, part of it is if bedwetting happens, and it's maybe appropriate to a certain age, but we want to, if bedwetting is happening after your child has been potty training and it's happening most nights, then that's when we're oh, there must be something else involved. But especially after, obviously most kids are potty trained around the age of 4, so anytime after that, when they've had a really good shot at potty training or still having a really good time, that is an issue. And then we want to, and then constipation or just pain or difficulty with bowel movements, and then urinary incontinence during the daytime. So that looks more of oh, kiddo jumps off the monkey bars and has a little bit of leaking, or when they laugh they pee, or things like that. And then if your child is experiencing pain, so especially pain with urinating or passing bowel movements, if they are getting frequent UTIs, that might be a withholding situation. And then if they have frequent lower abdominal or bellyache pain, again, that might be more of a constipation issue. And then also just postural issues. So if pelvic floor isn't working, whether it's tight, whether it's weak, whether it's whatever, it can affect how we're sitting, how we're standing, how we're moving. And so it can also just cause stomach or back pain, but then it can also, we can see some pathologies in the hips and those kinds of things. And that can give us a good clue into how involved is pelvic floor and what's going on there. So things that contribute to pelvic floor dysfunction. So chronic constipation, frequent UTIs, sensory concerns, and weakness or dysfunction of other muscle groups. So with chronic constipation, pelvic floor can get tired from just supporting stool in the rectum for a long period of time, and then it gets tight and irritated that way. Frequent UTIs, again, those are already uncomfortable, and then sometimes muscles just react poorly to that and can get really tight and irritated that way. If we have sensory concerns and then we have avoidant behaviors or withholding, then those might lead to the previous two or something similar like that. And then maybe we need to work on more behavioral strategies. And then weakness or dysfunction of other muscle groups, right? If hips aren't super strong, then pelvic floor is probably working extra hard, or vice versa. And so we just want to make sure that everything's working up and down the chain is working really well. So what does an evaluation look like? I like to go over this because I think it's important that parents know beforehand and that families know beforehand, so that your child isn't shocked when they get in here. So as far as for pelvic floor evaluation, we will talk about bathroom habits. We will talk about we'll do a good movement analysis and a posture assessment, and then we'll check on those pelvic floor muscles. So what do all of those things look like? So questions I ask during that first visit is like, how often are you going to the bathroom to pee? Because sometimes it's like, are we going all the time? Are we not going enough? Maybe we need to find a better option there. How often do you have a poop? Because, right, we should be pooping every day, ideally, maybe every other day. But if you're falling into that like 3 to 4 days, like then that's something that we want to work on. And then how do you wipe your bottom? This is really important, especially for like more of the UTIs and like when they're reoccurring, and how we want to make sure that kids are wiping well. Like sometimes they just don't know or forget or think they know. And so we want to teach them, make sure we're wiping front to back. And then if you're not reusing that piece of toilet paper, or making sure they like fold it over so that you're using a clean piece of toilet paper when they wipe for another time if they need to. And then, do you know what your poop looks like? And this is a question that I think a lot of us don't know. And I am learning that just like we aren't good at looking at our poop and like deciding, like noticing that it really is like a marker for our health and well-being and like how we're doing. And so one, I think, is I talk about how it's important to tell kids to look at their poop and kind of see like, oh, what does this look like and how does this feel? Because then they can tell their parents, oh, I'm sick. Oh, I don't feel very good, right? And then I have like really runny stool, or I'm having like these really hard stools, and then they need to like figure something out that way because those are really hard to pass. And so just like being aware is helpful, because I think a lot of kids don't know that like what normal poop should look like, right? And then also, if kids are having leaks, what are they using pads and liners? Are they using, right, if they're having leaks at night, are they using like a pull-up? How often are they changing? Those kinds of things. That just gives me an idea of how often this is happening, if we need to fix something from just like a hygiene standpoint, those kinds of things. So then we go to movement analysis and posture assessment. And so everything, like I've already said, just all works together really well to support all of our daily movements. And so I will look at, how does your child sit down? How do they squat? How do they stand? How do they jump? All of the ways, like we'll try kind of, obviously it's like pediatric, so it looks a lot more like play, but we are just looking for like, how do they move and all of those kinds of things. So I will ask your kid to do all those things. I'll see if they can touch their toes, right? And looking at just the range of motion of their spine and the range of motion of their hips, especially. And then if there's anything else that cues me, those for sure I will go over. But if there's anything else that cues me of like, oh, maybe I need to look at like your shoulder or something like upper back or those kinds of things, or maybe I need to look at your knee, I will look at those as well. And then I'll move to that pelvic floor muscle exam. So what I do with that is, when I want you to know up front what that looks like, but that doesn't happen, I go through exactly what it looks like, which I'll go over in a second, but then I don't even do the pelvic exam unless I have the consent of both the child and the parent. And right, again, we're using age appropriate terms, like I'm going to look at your bottom, those kinds of things for younger kiddos, that kind of information. And again, the only time I touch your child during the pelvic exam is if I need to, which sometimes I don't even need to. Sometimes I have to spread glute tissue just to be able to check their anal wink reflex, but usually I don't even have to do that just because kids are small. But I will check the anal wink reflex with a cotton swab or just like a Q-tip to see if that responds well, because that gives us a good understanding of neurological input there. And then I'll just ask and see like, what does your child do when I ask to squeeze and when I ask you to like push, like a pushing out stool, because they might just be doing it backwards. And that's something that is like pretty easy to fix with a little bit of practice. But if you're like bracing and trying to push out this hard stool and then you're actually squeezing, then it's making it harder to come out. And so we kind of talk about that and like what it should feel like. But again, it is your child. I set up the table with the sheet, and your child covers with the sheet. I step out while you're changing, and then I come back in and I just look at bottom, and it probably takes less than 5 minutes. But I just like everybody to know that beforehand, just so that you can tell your child that like, I'm probably gonna look at their bottom. Again, I can still do things without looking at this, and that's okay. So just like know that if we don't get to this today, you don't have to like, we can do it another day. It's not a big deal. So what does treatment of the pelvic floor look like after we've done all of that? So after I get a good assessment of your child, then we'll look at we'll just talk about education of like how your bowels and bladder work, because I think it's really important that, like, again, like there's our kids just don't know, we barely know like what's going on inside of us and all those kinds of things. And so we want to look at how we can best support your child that way, and just giving them a good understanding of what's going on and why they're here and how we can help them. And then we talk about positioning for passing stool, just because a lot of times kids are constipated, and so we will position them to pass, just work on like good toileting positioning to make emptying bowels a little bit easier. And then again, wiping and hygiene education, just like, are we wiping really well? Are we like changing pads when we need to? So we're avoiding UTIs while we're still figuring out some leaking, those kinds of things. So just kind of from that angle, we'll address like just like how healthy are we being, and then also just general healthy habits to make lifelong improvements. Like again, constipation can be like a long-term issue, and so a lot of times we talk about just like fiber intake and getting a lot of fruits and veggies and getting a variety of fruits and veggies. And why that's important. And it's just, I get like, it can be really hard, especially as kids with like food aversions or picky eaters, or like kids with ARFID. And so sometimes, right, like sometimes Miralax is just the deal, or like some other form of supplementation, whether that's magnesium or whatever ends up working for your kids. But a lot of like, we still want to try to do our best to encourage like good healthy habits, but not only is it make your pelvic floor happy, but then it's also just like good for you in the long run. Then we talk a lot about breathing. If you know anything about pelvic floor physical therapy, whether this is in pediatric patients or in adults, is the diaphragm and the pelvic floor mirror each other, or they ideally should. So when you inhale, your pelvic floor should relax, and when you exhale, your pelvic floor should return to neutral. And so it should have like good mobility that way. But if we aren't breathing appropriately, that can have a major impact on pelvic floor toileting. So sometimes people are just like mouth breathers, and so they end up breathing just like higher up, and so we have like poor mobility that way. And then especially just like taking this breathing and applying it to toileting, and making sure we're like breathing on the toilet can be really, really helpful as well. So we talk a lot about breathing and making sure we know how to do that. And then we'll move back to more like exercises. So this can be specific to pelvic floor, right? Like, are we doing some like stretching, mobility kind of stuff? Are we working on contracting and relaxing? Or are we just looking on making sure that we have like good hip and back support, core is working really well, just depending on what your child's needs. So we try to integrate that into daily activities so that we can like send you home with some things that you can do as well to help support your kid. And then just kind of like adjusting as needed based off of like what we continue to find. Obviously, I'm like always reassessing your child and those kinds of things of just like what's getting better, what's not, what are we missing. But again, it's just part of it might look like play, but like everything has a purpose behind it, and we want to just like improve participation as best that we can. So when would you consider pelvic floor PT for your child? Well, if constipation doesn't improve with diet or routine changes, so if you feel it, if you try the supplements, if you try the diet and try and improve, just like food wise, or if you've like, okay, this isn't working, and we try to like give them a new routine and it doesn't really work, right? If anything is painful, and sometimes that just looks like avoidance. Some people, like some kids avoid just because, but sometimes it looks like avoidance because it's painful. And so are we like asking kiddos, oh, like what does this feel like? Or like, is this painful for you? And then if you're having, again, that like consistent leaking after like potty training age. So what should you expect during physical therapy? So often, how long will your child come for? Usually we start with like 2 times a week, and then we reduce frequency as your child improves, because it's so much education up front and just figuring out like what's going to work for your family, what's going to work for you, right? I try to make it as like doable as possible without adding like a million things to your plate. So those kinds of things. So we'll start more often and then kind of like decrease across. Typical therapy takes about 3 months, but again, that's not like twice a week for 3 months. It's like that would be like hopefully once every other week or just like a quick check-in by those last couple visits. But again, can be variable based off of your child's needs. If we have like more like if we can't do some certain things, like then we might need a little bit longer to work on muscles, or if we can't like if muscles aren't responding really well, then maybe we need to like change some things up with diet, those kinds of things. And then again, homework. So obviously you spend way more time with your kid than I do. And so I try to give you things to do at home just to make sure that you can like continue to facilitate things at home. Because you get to spend way more time with your kid than I do, right? I'm seeing them max 2 hours a week. And yeah, that's just like probably not going to be enough. And I mean, I do the same things with my adult patients. And so we just want to make sure that those are good. So what are some benefits of pelvic floor physical therapy? Just control of bladder and bowels, right? Pain relief, overall improvement in body function and movement, and then obviously just some mental health. Like bowel and bladder problems are hard and can be frustrating, and so that is really important. And then overall just like long-term health, like right, if we can get bowels functioning better, that actually makes a lot of improvement in just our overall health in general. And then a couple other things I just like to touch on at the end here is how can we best support your child, and how can you best support your child through this process. But just like talking positively, like, hey, like, you know, I get that like coming to therapy isn't that fun, right? But like, can you try to talk positively about me and the coming to therapy and like why it's important and how it's going to help. And then also celebrating progress, just like, oh, like great job going to therapy today, great job doing your exercises today, great job doing this, right? And then like how we can do that. And then also like being involved and engaged. So can you get your, right, can you do your exercises with your kid even though they seem silly? Or you probably can figure out a way at your house to like implement something similar to what I do here. And so just can you participate and be excited and just try to like celebrate your kiddo. The other thing that I didn't mention is a lot of times we use the word accident, like, oh, like we had an accident, and that indicates that your child has some sort of like control over what happens when they have leaking. And so using the word leaking is actually really like a little bit better, just because then like your child can't feel blame, like it's not their fault that they're having leaking a lot of the time. It's like all the compounding factors, and then like there's just like so much going on in their little bodies. And so I really like to just encourage people to use that wording instead. But that is all I have for you today. Thank you so much for coming. And then if you would like any more information, feel free to reach out to us at Reborn. And yes, we really appreciate your time. Thanks so much.